Are you losing weight without doing any effort? Are you very happy about it? But do you know this kind of unintentional weight loss can be an indication of a very big problem happening inside your body? And what are those problems which can make you lose weight? That's what we are going to learn in today's video. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Lot of times people come and ask, Doctor, I'm losing weight. I don't know why. Well, why? We need to find out, because this kind of a weight loss is not a healthy. If you are not doing any special efforts in terms of having a very healthy diet or change in your physical activity, then this could be a sign of a much deeper disease happening within your body. Many times people start losing weight with no effort and they get very happy about it. Wow, without doing anything, I'm losing weight. People compliment them and this motivates them more. But rather than being happy about it, it's very important for you to know why you are losing weight. And you should not be happy about it, because many times once the reason comes out, then the person are usually depressed and they don't like it. So let's find out what all reasons it could be. The very first reason is a diabetes. Yes, especially you do not know that you have a diabetes. You are losing weight. This can be indication of a diabetes. Not only the weight loss, but other symptoms like feeling more thirsty, feeling more hungry, going to washroom again and again, having infection in your private body area, itching over the body. These are some common reasons or indications which can indicate that you have a diabetes. And once you correct that, whatever weight loss you might have achieved may come back. See, losing a little bit of weight in your body is fine, okay? Maybe 1 or 2 kg if you lose, that's okay. This doesn't need any medical attention. But when you start losing more than 5% of your body weight, or more than a 4.5 kg or 10 pounds, this needs a medical attention, because this is an unintentional weight loss. And that's what you need to pay attention. Most of the time, by the time you are in your middle age, your weight is almost stable. Few kgs here and there, but otherwise your weight is stable. But losing more than that is of a caution. So one reason we saw that was a newly detected diabetes. Second reason is uncontrolled diabetes. Yes, let's say that you are aware that you have a diabetes and you are taking medications for the same. But if your diabetes is not controlled well, this is a sign of weight loss is a sign of uncontrolled diabetes. See what happens. Many times people keep consuming the same pills for their diabetes. They don't go back to their doctor for their follow-up. And when they don't follow up, they are not aware how well the controlled is. And by the time they realize they are losing weight and then they go to their doctor, they realize that they have an uncontrolled diabetes. So that should be kept in mind. Not only that, people who have a diabetes often consume different kind of pills, and those medications can also be the reason of a diabetes, can also be the reason of a weight loss. What are those medicines? First is the Metformin. Yes, very commonly prescribed medication for the diabetes, and lot of people take it. In fact, it's a first line of a drug. But do you know that if you don't take Metformin in a right way, you are not going to get any benefit. When you're consuming Metformin, you need to have some special precautions. If not, it can be a life-threatening for you. What are those precautions and how to take Metformin correctly? I have made another video for the same. If you want, you can watch that video. That will give you a lot of knowledge. Though metformin is considered as a weight neutral medicine, but sometimes some people do experience few kgs weight loss. Second medicine is a DPP-4 inhibitor. DPP-4 inhibitor is a class of medicine which is used almost since a decade now. A lot of medicines are there in this: sitagliptin, vildagliptin, teneligliptin, linagliptin. All these gliptin family medicines are also weight neutral, but sometimes some people do experience few kgs weight loss. Third medicine is the SGLT2 inhibitor. Yes, SGLT2 inhibitor is relatively more newer class of a medicine. Empagliflozin, dapagliflozin, all this gliflozin family medicine comes from the SGLT2 inhibitor family. How this medication works? They throw excess of a sugar in your urine. Now we all know that sugar is a calorie. 1 gram of sugar is a 4 calorie. So imagine when you are throwing sugar in your urine, you are practically throwing calorie in your urine. And that's how you lose weight. And the fourth and the newest in this management program is a GLP-1 receptor agonist. This GLP-1 receptor agonist medicine comes in both the forms, injectable as well as the oral medication. And these medicines cause the maximum weight loss. In fact, that's how it has become more famous for. So if you are taking any of these medicine for your diabetes management, possibility that you are losing weight may be because of this medications. You can speak with your doctor about it. Okay. Another condition where you lose weight is a thyroid. Yes, people who have a diabetes have a higher tendency of getting a thyroid, especially of the hyperthyroidism, where your thyroid is functioning more than required. So if you have high T3 and high T4 hormone in your blood, that is causing your metabolism to be very, very fast. And because of that, you might lose weight. Of course, there are other symptoms of a high thyroid hormone in your body is, having tremors in the body, feeling uneasy, forgetfulness, sleepless nights or insomnia, confusion. These are the certain symptoms which can happen if you have a hyperthyroidism also. Alright. Fourth reason, especially in the diabetics, is the infection. Yes. So if you have any kind of infection, especially infection like tuberculosis of the lungs. So this TB or tuberculosis can cause a weight loss. So if you have a weight loss along with a feeling tired and having a cough, which is for a long period of time, not going away with cough syrups or the medications, okay, this can be a sign of a tuberculosis. And tuberculosis has nothing to do with a socio-economic background. We have seen people with the tuberculosis living in a very, very high socio-economic region also. So tuberculosis is one such reason where you lose weight, again very common in people with the diabetics. Another reason is a mental diseases. Yes, sometimes when you have a long-term health problem like a diabetes, you don't like it, and that causes you to go into a stage of depression. And when you go into depression, your eating habits change, and that can also make you lose weight. Not only that, people who have a diabetes also are at high risk of having a disease like Parkinson's disease. Again, you lose weight in such situation. Another mental illness is the anorexia and bulimia nervosa. Both of these conditions again common in diabetic and more commonly in women. Okay, see what happens when you want to lose weight. You tend to become little conscious of your eating habits. Okay, this little bit consciousness is fine and that everyone does. But when you become over cautious about it, you purposely eat very, very less quantity. Or oftentimes you eat food and out of a guilt you induce vomiting and then you vomit out. So this is a mental sickness, and that's what we call it as a anorexia and bulimia. Lot of people have it, especially in a women, and they are the one who lose weight. So please make sure that you don't have such kind of a health problem. If yes, you speak with your health provider accordingly. Right? Another common reason among diabetics is a use of the other medications. Yes, in that very commonly used medicine is a laxatives. Yes, laxatives, what do? They throw out the excess water from your body. So plenty many people take such laxatives and they tend to lose weight. Not only that, if they are consuming any medicine which is controlling your thyroid hormone, okay, again over correction or under correction of thyroid problem can also make you lose weight. Another problem is the chronic diarrhea. Yes, see, when we eat outside and if that food was not hygienic, we do get loose motions for a 1 or 2 day, and that's fine. That's an infectious acute diarrhea. But when you have a long term diarrhea, you are having loose motions every now and then, that is a bad, because chronic diarrhea causes your body to undergo into malabsorption, and that is again very common in people with a diabetes. In fact, diabetic people have a autonomic neuropathy problem, what we call it as a gastroparesis. And when you have a gastroparesis, these are the people who have a long-term diarrhea and which also makes them lose weight. Right? Another condition is a malnutrition. Yes, so whatever you are eating food, you are not able to get the benefits out of it, the best nutrients out of it. That's called as a malnutrition. And this often happens because of the pancreatic health problem. See, in our abdomen, we've got a pancreas, and this pancreas secretes very important digestive enzymes like amylase and lipase, which helps in a protein and fat digestion. Plenty many times, especially in a diabetic people, they have this pancreatic enzyme deficiency, and because of that they are not able to digest and absorb these nutrients. So such kind of pancreatic problem can lead you into malnutrition and thus cause you lose weight. Not only that, a lot of people have another abdominal health problem, what we call it as a celiac disease. These are the people who have a very sensitivity to a food ingredient like a gluten. They are in fact intolerant to gluten. And this again happens more commonly in a thyroid and a diabetic people. So check whether you are not gluten sensitive, and if yes, you need to change on your diet. And by the way, what is celiac disease, how that is connected with the thyroid, what all you can eat when you are on a gluten-free diet, I have made a detailed video on the same. If you want, you can watch that video. You will get more important information on that. Right? Another endocrine problem is the Addison's disease. It is a disease where your adrenal gland, which is located on top of your kidney, is not functioning well. Again, you can have the problem of a weight loss. Not only that, another reason is a cancer. Yes, okay. Now, cancer can be of any body part. So, when you have a cancer, you tend to lose weight, and especially if you have a hypercalcemia, where you have a high level of calcium in your blood. This hypercalcemia again can happen with the cancer patients also. These are the people who lose a lot of weight. So make sure that you check your serum calcium levels also along with the cancer markers. like CEA, that's a carcinoembryonic CEA. Then you can check yourself for the serum calcitonin to rule out any thyroid cancer. So these are the certain cancer markers which you can probably get a testing done. Not only that, sometimes addictions, your habits, that can also make you lose weight. So if you are chronically addicted to smoking or alcohol or recreational drugs, even that can make you lose weight, right? So losing weight not necessarily every time is healthy. Sometimes it can indicate a lot of health problem going within your body, happening inside your body without you being aware. So if you lose more weight consistently without doing any effort, go speak with your doctor, get the testing done, and find out what is the reason behind it and treat it accordingly. Alright? Losing weight, healthy way is always good, unhealthy way is definitely unhealthy. I hope after watching this video, you got some good and useful information. If yes, please click on the like button. If you are new to my channel, then don't forget to subscribe so that you get more and more health related information. And if you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. Plenty many people have asked me, where am I from? Well, I'm from Mumbai, India. And if you want to consult with me, you are most welcome to visit me in my clinic. And in case traveling is not a possibility for you, then in that case, you can avail an online consultation. I consult patients all over the world. And if you want to have a consultation with me, I'm giving you a contact number of my staff. She's the one who handles my appointments. You can note down her WhatsApp number. You need to message on that number. The number is 9987829999. Please be aware, it is not my personal number. I will not be available on that number. It belongs to my staff who handles the appointment. Right? We will meet again. Till then, take care of yourself. Namaste.